very important for you guys to think about is using what we call conversational continuers. So when you're chatting with people, or even if you're the greeters going over to get people to say, we're doing some pressure testings over here, let them talk and just say, that's interesting, can you tell me more, and just encourage them to open up and start talking, rather than giving them a whole series of quick, bullet-like yes, no, yes, no, yes, no questions. And finally,
you want to show a greeter at work?
Sure, talk about it, go for it. Yeah.
This is at a health fair that was part of one of our research projects, and it's this happens to be indoors, and you'll probably often be working outdoors. But this is a person who doesn't do any of the testing, is situated near the door, which is out of the frame of the picture to the left, and is simply there to intercept people as they enter the health fair site, and to greet them rather than just letting people sort of wander in and feel unwelcomed and unaccompanied in this strange environment. So as soon as people come into the zone of the health fair, there needs to be, or the health screening, there needs to be someone there to welcome them and to tell them what's happening. And we have this station over here which is doing blood pressures, and we have this station over here which is doing BMIs, and we have this station over here that's doing dental or oral health screenings. And you can go to these stations in whatever order you want. You don't have to go from 1 to 2 to 3. And what's brought you here today? And are you just one family or several families? Are you neighbors? Tell me a little bit about yourself. And now the whole experience has an entirely different quality to it.
The other thing that I would say about this, and this was done at a food pantry that we just wanted to do some testings at, and I don't know if you can do this, Heather and the rest of you, but just an investment in a few balloons really makes it a much more festive atmosphere. I mean, basically anything hospital-related for people who are not in it professionally, it's sort of grim and intimidating. And if you can make it just a little more festive with something like balloons, streamers, but it's just very little. 6 balloons could make a big difference. And then the other thing is, I don't know whether, I know at your big health fair that you do this, but to the extent that over here we have some freebie things that we're giving away, so people who got tested will be able to get some stuff for their kids, even if it's just free waters or something, but just a little, gee, we're going to give you this as motivation, we're going to do this for you, so you'll do this for us, always ends up being a very good idea. I don't know, do you ever have any things like waters or at the
Not
outreach?
at our screenings, but at our health fair we pretty much go all out. We did have balloons, we had this whole Monopoly theme for the health fair just to get the kids excited. We had a prize booth for the kids when they were playing games, and for the first, I think, 50 or so families who came into the health fair, they got a free bag.
Oh, yeah, our bags,
So hopefully we'll be able to continue that next year.
Yeah, and it really makes a difference, and the bags are very lively, full of lively colors, so it looks fun and so forth. But even for a routine blood pressure, I'd say a couple balloons is a really good idea. So why don't you just talk about
Okay. Well, this is another seemingly small point, but just to illustrate how you need to manage your own behavior. One of the very common transgressions of people in professional life is what is called preening, or self-tension. So here's a physician, we've posed him again, straightening his tie, and here he is picking a non-existent lint off of his trouser. And these are nervous acts that some people
He's a
have.
great physician, by the way. He would never do this.
Yeah, no, he's a
But we
lovely.
want to pose it.
Yeah, he's a lovely man, and he'd never do this naturally. But when you go into a social situation and you do this, you're sending a signal to other people that you're more concerned with your own appearance than you are with interacting with them. And to be picking lip in your trousers or subtly checking your watch, of course.
Or even playing with your hair,
Okay.
just things that seem to suggest.
Yeah. Constantly doing this. Constantly brushing hair out of your eyes.
Not a good thing.
I don't have any hair to brush out of my eyes, so it's not a problem that I suffer.
Yeah, but those kinds of things help grooming. So, we want to now talk about the actual consultation for those of you who will be doing it, and it really is a consultation. And to reiterate, there are 3 things that people want in any consultation with a medical professional. They want your time, so they don't want to feel that they're being rushed through. They want a sense that the professional will listen to them, and there are a number of questions you'll be asking them, so you really don't, even if it's 2 themes that you've heard today, you want to just get it together at showtime, act like it's your first one, and have that same level of investment and interest and responsiveness and curiosity. And the other thing that's really, really important for the person going through this is they should have, and you should provide for them, complete understanding of what's going to happen, how is this going to unfold. And the way that you'll do that is by first introducing yourself by name, hello, I'm Susan Evans, and by wearing a name tag, so if they forget your name or didn't quite hear it, they can always ask you by name. You wear name tags, don't you, Heather?
For kids' health sites, I should give adult health sites name tags too.
Yeah, no, name tags really, really help a lot. And you'll stand up and shake hands with the client who's coming in. And you'll introduce your role, and we'll give you a script in a minute, that you're a student at USC and have been trained to take blood pressure readings. Then you'll usher the client to the seat, and then you'll go through the script. And what we want to do is go through this script with you, and we know that it can be improved. And I can send this version to Heather, and then whatever improvements we would make today can go into it. But basically what you want to do is introduce, calm the person down, and give them 2 kinds of information at least. One is what's called procedural information, and that is let the person know exactly what's going to happen. And you might think that everybody understands what is going to happen when they have the blood pressure taken, but you shouldn't assume that. It may be novel for someone, or they may have had it done a different way. And so you want to tell people exactly, I'm going to take your blood pressure, I'll put this cup on your upper arm, and you show the cup, and then I'll squeeze air into it, and we'll listen to the pressure with the stethoscope, and you'll show them the stethoscope. And then you also want to give them sensory information. And sensory information is exactly how things are going to feel, taste, smell, sound. And for blood pressures, you're going to say, you may feel a bit of pressure for a few seconds while I put air into the cup. If you feel pain, let me know. Now, why is it so important to give procedural and sensory information? Because the more you can tell people and the more they can imagine what's going to happen, they have a vision of it, the less freaked out they will be once it does happen. So maybe the pain or the pressure on their arm would be different than they imagined, but you disabuse them of the thought that that's something to worry about. You said, let me know if there's any pain, just let me know. So giving people procedural information and giving them sensory information is absolutely important for them to take control of what's going on in the situation. And then the other thing you should do is to ask permission to begin. You're going to be doing something, if not intimate, certainly close with someone, whether you're poking their finger for a finger stick or whether you're doing a blood pressure. So you want to ask permission and get them to say, so you'll say to them, I'm happy to answer any questions you may have. May I begin now? And you don't begin until they have said, yes, I'm ready. Because their voicing that makes them feel more empowered, makes them feel more engaged, makes them feel more connected to the experience that you're going through. So here are some scripts, and I think what makes sense is for you guys to pair off in twos and read it to each other, because reading it with your eyes doesn't work. This is one of these things that you have to do by reading aloud. And take out, I think, a pen or pencil, and as you go through it, let's have you mark off places that you think are awkward or you feel you couldn't say comfortably, and let's try to get a script this evening together that will be really workable for you guys.
I think we've kept you too long.
Yeah, but it's really fun. I mean, you can see we're really excited about the work you're doing, and we stand ready to, help in any way we can with any of these design issues. And the best thing, of course, one last thing, since we are researchers, is the best thing to do is try it, take it out, research it, talk with a few people, say, how does this strike you? And you'll get a sense of, gee, the type is too small, and we're going to be talking about health literacy, so you want big font, lots of white, not a lot of stuff on there, just the basics. Okay,
so it's going to be a great year, and we're glad you could all come on tonight.
Yeah.